Hi guys, today I'm going to talk about some of the latest studies looking at COVID-19 in children. Hi everyone, welcome back to the channel, and I'm Dr. Han. Now in this channel you will find science review content as well as updates on COVID. I also like to share learning tips and tricks for students' academic and personal development. If you have already subscribed, thank you for coming back, and if you are new to the channel, please consider subscribing. This channel needs your support to grow. Today we're talking about the topics relating COVID-19 and children, and I'm really making this video in terms of as a parent and as well as a teacher. Now my university is going to have classes start on Monday, August 24th, and my son goes to elementary school, which starts in another 2 weeks. The news has been around going back to school and what we need to look for. So in today's topic, we are going to look at some of the latest research and how the virus behaves a little bit differently in children and what are the implications when school starts. Now, if you're a parent and if you're a teacher, hopefully you will find this video a little bit helpful when you are making decisions or making some precautions for your children and as well as protecting yourself and other older family members. Specifically, we are looking at two different studies today talking about viral load or virus load in children and in comparisons to adult as well. And we'll also look at the implications for back to school. So again, there is a disclaimer, so this video is my summary and opinion of publicly available informations that are in the topic, and this video does not serve as any advice regarding diagnosis, treatment, and preventions of any disease. And if I mention any specific corporations in the video, I have no ties to it. So let's first look at the backgrounds of this topic. Now, it has been known for a couple months that children with COVID-19 usually have more mild or sometimes no symptoms. And on the other hand, there are also children have very severe immune response to the virus as well. So there are studies looking at understanding how children plays its role in the development of the disease. And most importantly, what is the implications for school reopening, right? So here is a picture I find online showing two kids going to school during the 1918 Spanish flu pandemic. So back then, there were only 3 cities that continue to open school because they were saying back then a lot of the kids didn't have very good living environment, and being in school could actually protect them from contracting the disease back home. So in today's world, a lot of us are living in a better health conditions compared to 100 years ago. Now going back to school, the implication is not only limiting to protecting children from contracting the disease, it actually have more implications related to students' learning and social interactions. So let's look at 5 facts about COVID in children. So the first fact is about the amount of the virus in children. So there have been some contradicting results observed in 2 different studies. There were one study looking at children patients in Massachusetts. They concluded that within the different age groups, there were no significant differences in terms of its viral load collecting from nasal swab samples. On the other hand, another study conducted a little bit earlier in Chicago, they find out children less than 5 years old actually have a much higher viral load compared to other age group of children. Now, this result certainly conflicted with each other. Some of the difficulties lies involved in how do you do a good nasal swab with very young children, such as less than 5 years old. I have an 8-year-old myself. I couldn't imagine putting a swab into their nose up high and get the sample. So it would be quite difficult, and that may lead to some of the differences in the result between the 2 studies. Second fact, children viral load versus adult. Now, it has been shown that asymptomatic children actually have a similar viral load as to those adult patients that are already hospitalized and intubated. That means those very, very severe adult patients with COVID-19. Another observation was that asymptomatic children also have a higher viral load compared to adult patients that has been hospitalized for 7 days that hasn't gone into intubation yet. Clearly, the same amount of viral load produced different effect in children and in adult. In adult, they were much severe, and in children, sometimes they could be asymptomatic. Now, let's look at the third fact, the ACE2 receptor levels. So in one of the studies that I quoted today, they show that there are lower level of ACE2 receptor in children in less than 10 years old. Now, a little bit recap, ACE2 receptor is the main receptor where the SARS-CoV-2 virus bind to. Now, but this changes actually when the children are infected with the virus. Having infected with the virus, receptor expressions actually ramped up. So the lower ACE2 receptor level could be an explanation of why children have a little bit lower infection rate compared to adults. Now, let's look at the symptoms difference in adult versus children. In adult, one way to tell the symptom differences between COVID-19 flu and cold is fever. Now, cold rarely causes fever in adults and is fairly common in COVID-19 and as well as in seasonal flu. Another symptoms that it stands out in adult is the runny nose. Now, runny nose is or stuffy nose is very common in flu and cold in adult patients, and on the other hand, is kind of rare in coronavirus infected people. On the other hand, in children, this story is a little bit different. Now here I am showing you a data heat map I cropped out from one of the study that I have today. Now in this study, it's showing you different type of symptoms corresponding to children with the SARS-CoV-2 and without the SARS-CoV-2 virus there. Now, there's a lot of symptoms here, but I want to point out in this figure is something related to the nose. Congestions and rhinorrhea, i.e. stuffy nose and runny nose. And you look at the symptoms map here. Children without, the first line here, without virus and with the SARS-CoV-2 virus, they both have very similar symptoms. They both have stuffy nose, they both have runny nose. Now maybe stuffy nose is more severe in the SARS-CoV-2 compared to those that without. So essentially the differences are very difficult to tell, and these lack of differential symptoms makes it even harder when we are going into fall allergy seasons where runny nose is a common symptoms. On the other hand, we are looking at fever. Now, children always get fever when they even get a cold, so this is very difficult to tell. So what I want to say is there are very limited data backing to look at symptom differences to tell if the children have a cold versus a flu or versus COVID-19. So monitoring symptoms in children may not be as reliable to track the disease progression. Now looking at the last factor, the fifth factor, antibody response. Now children are known to have a severe form of immune response to this SARS-CoV-2 virus. This severe response is called severe multisystem inflammatory syndrome, or abbreviated MIS-C, i.e. in children. Now, when children have these situations, they have an overall increase in IgG antibody, i.e. those antibody that supposedly specific for different type of viral infections. But in this case, in children, they have a overflood of all these IgG that are not necessarily only specific for COVID. Actually, they have IgG overflood in response to other respiratory diseases, okay, and viruses. So this is something that is different compared to adult acute infections, and also different than children with more mild cases of COVID-19. So overall, the message is that children having MIS, they are experiencing a very overreactive T cell and B cell response, i.e. cellular response to the infections and as well as antibody response to the infections. So coming to the take-home message here. Now the SARS-CoV-2 virus amount in children does not really match the severity of the symptoms. They could be having a very high load, such as those in severe adult patients, but while they are not experiencing symptoms. So the viral load differences in the different age group appear to be inconclusive at this point. Some of the limitations lies within how you collect the sample in very young children. Okay, it's very difficult to stick a cotton swab into their nose and get a good collections. Now, in terms of other symptoms of COVID-19 in children, they are very non-specific and very hard to tell from other upper respiratory infections. That makes symptom monitoring a very ineffective way, especially for schools that are opening. If they try to monitor symptoms, they may not be as effective. So the last take-home message is that schools and parents really need to take extra cautious to prevent disease spreading between children and adults. In many cases, children appear to be fine, but if they are indeed harboring viruses, they could very well spreading that to older adults at home. So to learn more about this topic, I have these two articles that I looked at for today's topic down in the description box below. So feel free to check it out and also have a discussion with me. So hopefully you find this video a little bit helpful, and if that's the case, please give me a thumbs up and a like, and also leave some comments so that we can have a little bit more discussions on the topic. And that is all for this week's COVID-19 update, and I will see you again next Sunday. Bye.